Hello everyone, welcome back to my YouTube channel. Today I'm going to be talking about why progesterone testing on cycle day 21 is wrong. Yes, before you punch me in the face, listen to me first. So a lot of people go for progesterone testing on cycle day 21, and 90% of the time 90% of women come back with a low progesterone result. Yes, because it is wrong to test progesterone on cycle day 21 if you don't have a 28-day cycle. What the doctor is saying, don't get me wrong, I'm not saying the doctor don't know what he's saying. The only problem is the patients don't understand what the doctor means. So the progesterone testing on cycle day 21 means the doctor is saying come in on 7 days past your ovulation. So for a woman who has a 28-day cycle, or let me say for a woman who happens to ovulate on cycle day 14, on the 21st day of her cycle is 7 days past ovulation. And what happens on 7 days past ovulation is that your progesterone spikes, it starts going up. Immediately you ovulate, your progesterone goes down, and then on 7 days past ovulation, which is cycle day 21, your progesterone starts going up. Progesterone is called the pregnancy hormone. It is the hormone that keeps you from seeing a period. As soon as it drops, you get your period. So if your progesterone stays high, it gives you a longer chance at getting pregnant. That's what they call the luteal phase. You say, somebody said they have a short luteal phase, a long luteal phase. So when your progesterone goes up and you go for a progesterone test on that day 7, it shows that your progesterone is normal. That's why the doctor will say come in on cycle day 21. It means 7 days past your ovulation, so that he will test and see if your progesterone is relatively low on that day. It means you are not ovulating, or there's something wrong with your hormones. So some people ovulate on cycle day 19, cycle day 17, cycle day 15, which your progesterone is not yet time for it to start going up. And then you have a 35-day cycle, and then you're going in on cycle day 21, which maybe you might just ovulated 3 days ago, and then they will definitely tell you your progesterone is low. And then you come back and maybe your doctor gives you some drugs to go take so that your progesterone will be normal. That is even when your hormones start getting unbalanced, because they were balanced before, but you didn't know your 7 days past ovulation. You went in on the wrong day because it was your cycle day 21, and then now your doctor assumes, because it's not in your body, so he won't know when you ovulate, and he assumes, okay, your progesterone is low, and then he scatters your hormone by giving you drugs to take to correct that hormone. So before you go for a progesterone testing, please know when you ovulate. Chart your cycle or buy an ovulation test strip to test. When you test, when the positive comes, it shows you are going to be ovulating in the next 12 to 36 hours. So now if you test today, you will know that by next tomorrow, which is Saturday, you should be ovulating. So you start counting from Sunday as your first day past ovulation to the 7th day. You will now go for a progesterone testing. You don't just get up and go for a progesterone. Even for a woman who has a 28-day cycle, she might not ovulate on cycle day 14. She might ovulate on cycle day 13, 12, or 15. So progesterone testing on cycle day 21 is wrong. You need to go in 7 days past your ovulation. That's what your doctor means. So thank you all. I hope this video makes sense to someone. And if you are watching me from YouTube, please go follow me on Instagram at Fertilemoms. If you are watching from Instagram, go subscribe to my YouTube channel, the Fertilemoms Hub. Thank you so much. I'll see you again in my next video. Bye.